Managing a belly button ring while pregnant. Pregnancy tips. Learn options for belly button jewelry while pregnant and avoid infection. Many women resist removing their belly button rings during pregnancy, especially if they are younger and this is their first birth. Piercings can sometimes bring comfort to a pregnant woman as reminders of her non-pregnant physical appearance. You may be wondering if there is anything you can do to manage your belly button ring. The first step is to ensure that you're staying as healthy as possible during pregnancy. This will reduce the risk of complications of any sort, including those arising from belly button rings. I recommend reading these pregnancy tips. The following are choices for how to manage belly button rings during pregnancy, whether you choose to keep the ring in place, remove it, or opt for a different style ring. Take it out. Most care providers recommend removing your belly button jewelry or ring. Even women who don't remove their rings report that they itch and pull as the belly stretches around the 5th or 6th month. There is also the risk of infection if the ring scratches you or opens a small wound. If you do take out your belly button ring, the piercing hole will probably close, requiring you to re-pierce your belly button after having your baby. Buy a pregnancy piercing ring. If you don't want to take out your belly button ring, you may want to purchase a non-metal pregnancy piercing ring. These are flexible and 2 inches long to accommodate your growing belly. Pregnant women claim that this product allows them to keep their bellies pierced without the discomfort. Watch for tearing. If you decide to keep your belly button ring in, watch for tearing or discomfort. If your belly button piercing becomes uncomfortable or infected, you'll want to remove it. If the skin around your belly button ring turns red, develops pus or starts to smell funny, you have an infection and should acquire antibiotics from your care provider. Talk to a piercing artist. You aren't the first woman to get pregnant with a belly button ring in place. Piercing artists may have some advice for you. They may suggest buying a different piercing product or buying a larger product. Talk to your care provider about your piercing if you need a cesarean birth. Most care providers will require you remove your belly button piercing if you are going to have a cesarean birth. However, some will allow non-metal piercings to stay in place. Ask your care provider about her rules. Consider purchasing a non-piercing or clip-on belly button ring. While these products may not help you keep your belly button pierced, they may help you feel better if you have to take out your belly button ring during your pregnancy. Caution: if you keep your belly button ring in place, watch for infection. Quick tips: talk to your care provider and a piercing artist about your belly button ring. They may have options for you. Useful links: pregnancy piercings, belly button rings are us.